Sub-Saharan Africa confirms its first coronavirus case. The death of a woman in Burkina Faso comes as the World Health Organization warns Africa must prepare for the worst with the virus. Good evening and welcome to African Perspective. I'm Aldrin Simpier. Tonight we go live to our reporters in West Africa and Europe, then two provincial health MECs in South Africa. We'd love to hear from you as well. You can do that by simply tweeting under the hashtag African Perspective. Kenya on Wednesday confirmed 3 more COVID-19 cases, bringing to 7 the total number of positive cases in the East African nation. Kenya's Health Cabinet Secretary Mutahi Kagwe said of the 3 cases, 2 are a couple that traveled from Spain on March the 4th and arrived in Nairobi on the 5th, while the other one is a Burundian national who arrived in Kenya from Dubai on Tuesday this week. Kagwe said efforts are underway to trace 85 people who were in contact with a patient who ran away from government quarantine in one of the country's isolation facilities. Meanwhile, Kenyan businesses are coming up with innovative ways to remain afloat in light of the ongoing partial lockdown in the country, even as parents seek ways to keep their children engaged as institutional learning remains suspended. Sarah Gamyani has more.
At the Tuskys supermarket in Nairobi, consumers go about their daily shopping. This around certain times. The chief executive officer tells the SABC that every day the turnout is remarkably different.
On the 13th, 14th and 15th, we had a surge in the number of customers, a serious surge. We only see that around Christmas time. So what happens is in a very short time, our customers all came at the same time in the stores. And they were buying hygiene products, but also they were doing their regular monthly shopping.
Last week, President Kenyatta ordered a partial lockdown in the country to contain the spread of COVID-19. This includes limiting movement in malls and shopping centers. Businesses are now looking for innovative ways to get the essential groceries to their consumers.
Send your shopping list via WhatsApp or SMS to a number that is Tuskys, your regular Tuskys. The normal guys who normally serve you in Tuskys will arrange and pick and pack that shopping, and Sandy will bring it to your house and you'll pay by M-Pesa. Today morning, I think we've served more than 400 people.
The supermarket chain with outlets in Kenya and Uganda says it is hopeful that the slowdown of coronavirus in China will see their businesses bounce back, even as Europe begins a 30-day lockdown.
90% of our Chinese suppliers have now informed us that they are back to production. And in fact, the containers, the shipments that were delayed in January and February because of coronavirus in China have now been released and they are on the way to Kenya. Our tally is that 90% of what we get from China will continue to come. In fact, our worry right now is anything that we get from Europe and Turkey.
President Uhuru Kenyatta in a national address urged banks and other lenders to offer relief to borrowers and small and medium enterprises as the effects of the coronavirus outbreak begins to be felt in Kenya.
What we're dealing with today is primarily a health crisis. And we are focused on dealing with it as a health crisis. But realistically, and unfortunately, it is a health crisis that is bound to have financial and economic impact, and not to the positive, but rather to the negative. And as such, we need to pull together as Kenyans and to see how we shall overcome not just the health crisis, but the associated issues that are most likely to develop. You all know our tourism industry is going to take a hit. You all know our restaurant businesses, our small traders who depend on imported goods, which are now delayed because of slowdown in manufacturing in various parts of the world. And all of these individuals depend on you in one way or another. So your understanding to the plight that they are going through is something that I truly appreciate.
Just over 15 million children are now at home following the suspension of learning in the country. While some schools had preempted the closures, most were caught flat-footed.
That's correct. Well done.
At the Longhorn Publishers' offices, Managing Director Maxwell Wahome takes the SABC through the organization's e-learning platform.
Our content is a combination of assessments, revision assessments, and interactive learning materials.
Longhorn has for the next 30 days waived the learning materials subscription fee.
We charge between 500 to 1,000 shillings per child per annum. But we are in a very unique situation right now as a country. And with the COVID-19 virus and the shutdown that we have, we need as corporates to come back to the table and say, how do we support the close to 14 million children that are now at home without any learning solution to continue learning?
With recommendations by the government that parents observe social distancing, Longhorn says the response to the online classes has been positive, with numbers expected to go well past the current 200,000 subscribers.
As usual, maths and sciences are quite popular because those are ideally the subjects where people struggle to read remotely. You want to continuously test yourself with different kinds of assessments.
Kenya reported its first case of coronavirus on Thursday last week, forcing the government and businesses in the country to act fast to contain the spread of the deadly virus. Sarah Kimani, SABC News in Nairobi, Kenya.
The SADC Council of Ministers held their first video conference meeting today in the wake of the coronavirus pandemic. Many countries have suspended traveling for government officials. SADC Ministers of Health recommended a temporary suspension of all SADC face-to-face meetings in order to reduce the exposure to any spread of the virus. More than 400 cases of the coronavirus have been confirmed across the continent. Some African countries have imposed a range of prevention and containment measures against the spread of the pandemic. Although most SADC member states are yet to confirm cases, South Africa, Tanzania, Namibia, the DRC and Eswatini have confirmed cases. Meanwhile, Nigeria has now imposed travel restrictions that affect 13 countries. The West African country became the first sub-Saharan country on the continent to confirm the COVID-19 case. Africa's most populous country now has 8 confirmed cases after confirming 5 today. Phil Iza joins us now from Abuja in Nigeria to give us an update. Phil, good evening and welcome to African Perspective. What was the rationale behind the government's decision to impose these restrictions which affect 13 countries?
Oh, thank you, Aldrin. It's been, of course, in the news, the lawmakers, several reactions from the populace that, before now, for the federal government to place a travel restriction on several countries, especially countries that have been hard hit by the coronavirus. Sadly, that information came just about an hour before the country announced officially that 5 new cases have been discovered, and so if as much as the fact that the federal government announced it an hour before, it still created some form of panic on social media. Several people trading blame to the government for not doing it earlier and all of that. But the point here is that Nigeria has woken up to the reality of now having to deal with multiple cases, unlike it was in the first place, where the country only had just 3 cases. One of them tested negative and was discharged. And then the index patient, according to the health minister, was on his way to full recovery. And then, of course, a new case, which the government said was not a very serious one. But as it stands now, the country indeed has a huge task to face in tackling the coronavirus disease.
When it comes to these 8 cases that have been confirmed, did the government indicate at all whether these are local transmissions or how many of them are transmissions or infections, rather, that emanate from people who were traveling?
Well, for now, there are no indigenous transmission of the disease, as you put it there. All the cases are, related to travelers from outside the country into Nigeria. The 5 cases, we have 3 of them coming from the U.S. and then 2 from the UK, although there are citizens of the country, but then at the point as it stands, they are quarantined and they're being monitored by health officials. That's the reason many people, especially on social media, are reacting, to the fact that the government should have placed these travel restrictions on those 13 countries, which include the US, UK, Italy, China, Norway, Germany, Spain, and a host of others. They should have placed those restrictions, but that has been done now. Several government officials have also been barred from traveling outside of the country. 2 states, Lagos and Ogun states in the southwestern part of the country, have also restricted, public gatherings, religious activities with over 50 people at a time. And then other states, especially in the north, about 9 states are, considering, restricting schooling activities as well. So the country, like I said earlier, is beginning to wake up to the reality, and more stringent measures are, of course, expected in the coming days.
Does this mean that as it stands at the moment, schooling is continuing as normal?
As it stands, most activities are continuing as normal in the country. That's because Nigeria has 36 states and the Federal Capital Territory. For now, only in Lagos and Katsina states have these cases been reportedly tested as positive, or as the country discovered these cases as positive. So a majorly activities are still going on, even if people are taking precaution. There are periodic messages and sensitization from the government and health officials for people to maintain or improve hygienic their hygienic conditions. But then, like I said, with the discovery of this 5 new cases in Nigeria today, we're expecting to see more governments, more state governments, even at local levels and at federal levels, make proclamations and possibly put some restrictions on movement to be able to contain the spread of the virus.
What's the word from business?
Sorry, say that again. I didn't hear that.
What's the word from the business sector, from the corporate sector? What are they saying about the spread of the virus or trying to contain the virus? Are any of them considering suspending services, for instance?
Well, of course, the business sector, the economic sector of the country has been hard hit by the impact of the coronavirus. In fact, the aviation sector, for example, is almost shut down because various flights, international flights have been cancelled. Local airlines are still, transporting people from interstates, but billions of naira, millions of dollars have been lost in the aviation sector, the tourism sector. In fact, Nigeria is largely dependent on oil, crude oil earnings, but we've seen in the past few days and weeks how that the global oil prices have dipped to an 18-year low, and it's really affecting the country's economy because the naira as well has lost value to the dollar. Several economic experts are warning that the country might even slip into recession if this continues, except, of course, if the government wakes up to the fact of trying to cushion the effect of the coronavirus. But how that will pan out, we're still monitoring to see how it will all come out or come to play.
One last question. When it comes to the travel restrictions, I note that the decision is based on countries that have more than 1,000 cases that have been reported. On the continent itself, we just have over 190 in Egypt and over 116 here in South Africa. Is there any word or conversation that's happening between legislatures that the government should also consider which countries on the continent are highly affected by the virus and probably try to restrict the traveling from those countries at all?
Well, for now, there's no. For now, apart from the 13 countries, which are mostly countries in the European part, the countries in Europe, the U.S., China, that's in Asia. There are no word on African countries being banned because, of course, there is a coordinated approach as well from the African Union, from the West African region to see how that, the coronavirus can be contained. So far, there is no official statement or communication from the government to restrict fellow African countries. Rather, we're seeing some form of collaboration, information dissemination and sharing between the countries to ensure that the coronavirus is contained in those countries.
Phil Lihaza, thank you so much for your time. So when we come back, the conversation that we're going to have is a focus on that first case of a death relating to the coronavirus in Burkina Faso. We will be going to Ghana for an update with regards to that just after this.
Sanibonani, nginguzweli Mkhize ngqongqoshe wezempilo kuzwelonke. Isifo se-coronavirus esifikile eNingizimu Afrika. Akekho kufanele amangale noma ethuke. INingizimu Afrika imi ngomumo ukubhekana nalesimo esiphuthumayo. Asikho isidingo sokwethuka. Odokotela nabahlengikazi bakulelizwe baqeqeshwe banolwazi olwanele ukubhekana negciwane i-COVID-19. Umaphesenti ayi-82 e-COVID-19 abaguli kakhulu. Abantu baba nokushisa komzimba kancane, ukucobeka noma kwenzeke bakhwehlela. Amaphesenti ayi-6 kuphela lapho kudingeka khona baye egunjini labagula kakhulu. Iningi labantu lingazigulela lize lilulame lingazange lilaliswe ezibhedlela. Uma ukhathazeke ngempela ngezimpawu onazo, sicela uye emtholampilo noma kudokotela noma ufonele inombolo kawonke esebenza imini nobusuku u-0800 029 999. Nazi izeluleko ezibalulekile. Geza izandla. Zigeze ngaphambi kokupheka, ngaphambi kokudla, emva kokuya endlini encane, uma uthimula, uma ukhwehlela noma unakekela abagulayo. Sebenzisa insipho namanzi noma usebenzisa imithi uketshezi ebulala amagciwane. Okanye ungathintani nabantu abagulayo. Zama ukugwema ukuthinta amehlo akho, ikhala nomlomo. Hlala ekhaya uma uzizwa unomkhuhlane, khwehlelela noma uthimulele endololwaneni noma kwithishu bese uyayilahla leyo thishu. Gcina izindawo ezithintwa njalo ngesibulala magciwane zihlanzekile. Khumbulani ukuthi i-COVID-19 isifo esiphatha noma ubani, asibandlululi, nawe-ke ungabandlululi abanalesifo. Nobani singamngena kodwa singasinqoba. Ngiyabonga.
Africa is receiving assistance in the form of medical gear to help combat the spread of the COVID-19. The Jack Ma Foundation has sent a consignment to the continent to be distributed from Ethiopia. Chinese billionaire Jack Ma is the founder of multinational technology firm Alibaba Group. SABC's Coletta Wanjohi reports from Addis Ababa.
The 54 African states will get 20,000 test kits each, as well as 100,000 masks and 1,000 medical-use protective suits and face shields. The donation will be delivered to Ethiopia, from where the Prime Minister Abiy Ahmed will oversee distribution to other member states. The foundation says it will start providing online training materials for COVID-19 clinical treatment to medical institutions in the continent. So far, 42 African states can test for or diagnose for the virus. Most of them are using and depending on test kits and training from the Africa Centers for Disease Control and Prevention. Jack Ma says Africa can stay one step ahead of the coronavirus if the continent moves quickly. Abiy Ahmed has expressed his great appreciation for the donation of medical gear. Coletta Wanjohi, SABC News, Addis Ababa, Ethiopia.
Burkina Faso confirmed its first coronavirus death, becoming the first fatality in sub-Saharan Africa. The 62-year-old woman had an underlying condition, diabetes. We now go to neighboring Ghana in Accra, where the SABC's Nabel Ahmed is waiting for us to speak to us about that particular case that has now been confirmed. We'll also be speaking to him in the next while about what Ghana is doing to respond to the COVID virus and how those measures are being implemented at the moment. You would remember as well that Ghana is heading for an election later on this year. The big question is the country starting to have the conversation around whether the elections themselves should be suspended? Let's try and get back to Nabel Ahmed, who is joining us. Good evening and welcome to African Perspective. What do we know about this woman who has now died, the 62-year-old from Burkina Faso?
Thank you very much. Yes, we know that she died today of the coronavirus, and she's been having the disease for some time now. What we are learning is that she's 62 years old and she was suffering from diabetes and has been in intensive care since she was detected positive of the coronavirus. And today, she actually didn't survive the disease and she's actually gone. There are some who are saying on social media that she is a lawmaker, but then that has not been confirmed yet. But what we are seeing on social media is that she is a legislator, actually, Alvin.
Is it known at all whether she contracted the virus while being in the country or was she traveling?
What we understand is that it's actually an imported case. It wasn't something that she contracted whilst in the country. We understand that she actually came back from overseas, and that's when she was confirmed positive of the coronavirus. So this is one of the cases of the imported disease that we are having in the continent.
And let's then move on and speak about Ghana itself. How many cases have been confirmed so far? We're also seeing reports that there is at least 2 people from Anglo Gold Ashanti, if I'm not mistaken, that have been confirmed positive of COVID-19.
Yes, so far Ghana has 7 cases. It first recorded 2 cases, but now it has jumped to 7. Authorities have indicated that all the 7 cases, the patients are undergoing treatments and they are recovering fully. What we understand that we don't have any death at the moment, but then the 7 cases are in the hospitals, have been isolated, and they are receiving medical attention. Doctors are saying that they are responding to treatment as well.
Speak to us quickly about the 2 cases of Anglo Ashanti and what the company says it's doing in terms of trying to put in measures, because I understand there's also the issue around how many people may have come into contact with these 2 people.
Yes, with the Anglo Gold Ashanti, we are learning that these 2 cases were also imported. They also were outside the country and they returned with the disease. We had a statement from management of Anglo Gold Ashanti saying that once these people have been confirmed and tested positive, they actually had come into contact with some of the staff at the mines, and that contact tracing is being done, and also they are testing some of the staff that these 2 people may have come into contact with to test if indeed they have contracted the coronavirus disease or otherwise. But then all the staff have also been asked to go home, and also self-isolate while these tests are being conducted on them.
So as this self-isolation happens, what is the process that is then followed by the health authorities in the country?
So what we are learning is that because the health officials don't want people coming into the hospital with the disease if they do have it, because of course they would go through, they will pick transport, they would meet other people on their way to the hospital. So with those who have been seen to have come into contact with these 7 cases of the coronavirus, have been asked to stay where they are they would have to call the health service, and then health officials will actually move there, take their samples, and then send it to places for testing. In the Ashanti region, we know in Kumasi there is a testing center for the disease. So that's what's being done. These people are being asked to stay where they are. They shouldn't actually move, but then their samples would be taken by health officials in their homes or wherever they may be, and then the testing will be done to confirm or otherwise whether they have the disease, and then treatment would begin if there is a need to do so.
Speak to us quickly about some of the restrictions that have been announced by the president on Sunday.
Yes, so President Nana Akufo-Addo has placed a lot of restrictions. Schools have been shut. He's also asked people to social distance themselves. Social gatherings have been banned. Church services and Islamic programs have all been banned. On Sunday, we saw some churches have their last church services. This week, we are expecting that such congregation would not be held. The president has also said that he's tightened travel restrictions to some countries that are hard hit by the coronavirus. So let's say if a particular country has more than 200 cases, flights coming from that country will not be allowed to touch down in Ghana. We already know that there are some people from China that are already being turned away when they are able to, come to the Kotoka International
Nabil,
Airport.
unfortunately, we're running out of time.
By the Ministry
Nabil,
of
just
Information,
quickly, unfortunately, we're running out of time. I just need to ask you this quick question. Has there been any conversation that's happening in the country, whether it is from the opposition side at least, that there should be a postponement of the elections which are scheduled for December?
That has not been come up yet, but we should know that Ghana was supposed to have its new registration for voters' ID card, voter registration in April. That the Electoral Commission has said has been suspended, but then a later date would be announced. But then for the election in December, no word has come out of it. We only know that the registration for the voters' ID card have been suspended. We are not going to have it in April.
Okay, Nabil, Ahmed, thank you so much for your time. So that's the story that we have from West Africa. So when we come back, we'll be speaking to two MECs from this country, South Africa. We'll be speaking to the MEC from Limpopo as well as the MEC of Health from Gauteng. And South Africans who were repatriated from Wuhan in China have all tested negative for COVID-19. We now speak to Dr. Popira Mutuba, who is the health MEC in Limpopo. Good evening and welcome to African Perspective. It must come as a relief, though, that the tests are now out and the tests have come back as negative, because there were concerns that Limpopo was chosen as the place for the quarantine.
Evening, Adrian, and evening to all your viewers out there. We must indicate as Limpopo government that indeed we are relieved by these particular results, because when we have indicated the reason for quarantine, that people that you quarantine, it's not necessary, they are not positive. It's those that would be asymptomatic but would have been exposed to an area or been in contact with somebody with that. And government continuously, the minister, the Premier and the President also indicated that those people who are being quarantined at the range are coronavirus negative. They've been tested in China. We are just bringing them for safety, just because of the incubation period of 14 days. Let's allow that 14 days so that if there's anyone who might be having the virus, it must show itself during that time before we release them to can meet their relatives and their loved ones and spread the virus. So we're doing it for precautionary measure. However, the people of Limpopo, some of them were not really satisfied. So indeed, specimens were collected when they arrived. I think it was on Sunday. And last night, the minister called us and gave us the results and also announced that they've all tested negative. So it just shows that when for me, I'm simple saying it's not the first case. You remember there was the Capricorn TVET colleges students whom we were even forced because of the public outcry to contest them because everybody was saying we've released them, they are coming from China, which tells me that people are still obsessed in the fact that anyone who's coming from China is probably being positive of coronavirus. And I've been emphasizing this message that even the first case we have up until today, all these cases that are being reported on a daily basis, they're not coming from China, they're coming from Europe, they're coming from US.
Is this including the doctor?
Including the first case of Limpopo, which I predicted last week and say, whenever the day we will have a case in Limpopo, I can guarantee you it will either be the case from Gauteng, because most of our people, you know, when the statistics increase in Gauteng, I am very worried because most of our people are here, they are working here. So it means when you have more in Gauteng, it's simple saying Limpopo, it's at risk. So I was thinking that the person would be coming from Gauteng and come back during Easter holiday. But I would not say the person came from, it's a doctor who went overseas in Europe. He visited 3 countries in Europe just for holiday.
Let's just quickly touch on those anxieties that you may have as the health MEC. And we know that the N1 route to Limpopo becomes very busy on weekends, and now with the Easter weekends also arriving, what measures are you putting in place to ensure that the virus does not actually spread into the province?
I think we are trying our level best. Yesterday, the Premier had to convene a special executive council so that we can put systems in place, because you can't leave this to the MEC for health. We need to bring on board the MEC for community safety and transport. So together with him now, our target is we are working with Santiago to try to look at, because part of the education and training that we are doing as a health is to expand to relevant stakeholders, looking at the transport sector, which our bus drivers, we have got to really find a way how to put sanitizers within our taxis, in our buses, how to advise our bus drivers on how to protect themselves and also protect the passengers. But it still boils back to an individual. Today, the Premier launched our campaign, which we call it a walk. A walk simple means W, it's for washing. You must wash your hands as much as possible. Just wash your hands, and 20 seconds. Don't just go and throw your hands in water. Just wash it. And the A, it's about avoiding. Avoid rubbing your nose, your mouth, avoid gatherings, avoid all those things that we have. And the C, it's about cover. Cover your mouth when you cough, cover your nose when you sneeze. Then you will be able to protect. So if we can follow the basic work, we can protect.
What about those who don't actually do that? And I'm now thinking about, for instance, what happens at the various toll gates. Would there be screenings that take place at the toll gates at all?
You see, that's a question which people are asking. Who do you screen and how do you screen and what is the criteria for screening? Because initially it was easy. We would say anyone who has traveled abroad, let's screen. Now there is local transmission. Who do you screen now? Do you screen everybody who's coming? But the emphasis that we are saying is that we rather be seen in our roads together with the traffic, as I've indicated, that while we're giving the message of arrive alive, we must couple it with also arrive also safety, safe, protect yourself from this disease.
The Bait Bridge border post, measures that are being put in place there, that border post also gets busy, and I'm sure it will get busy now during the Easter weekend as well.
If we are to be honest, because people were even asking me today during our press briefing, why didn't President announce about the closing of Bait Bridge? The question that I still ask is the same as they saying why this China, people who are coming from China, why are you not testing? Instead of asking us to test people who are coming from Europe, you were focusing on saying let's test people from China. Now, who in Zimbabwe has got the virus. There's no one. There's no case.
I'm just thinking
So-
about...
so what we are doing...
You spoke about the spreading of the virus.
Yes.
In Gauteng, for instance, having the highest number,
Yes.
and those people probably traveling to Zimbabwe.
That's what I'm going to come to say. We as South Africans are a risk to Zimbabwe because we are the ones who are now having cases. So it's a matter of together with our Zimbabwean counterparts, we had a session, I think it was 3 weeks back, together with the Port Health from the side of Zimbabwe so that we can help each other to be able to continue with the screening. On our side, anyone who is entering, we are still scanning for your temperature, for any signs of fever and whatever. But then it means from also South African side, when the Zimbabwean nationals will be going home during Easter, we've got to strengthen our screening because if we don't do that, they are going to spread the virus into because most of them are coming from Gauteng also, who will be going to Zimbabwe. I agree fully with you on that one to say, as South Africans, we must also assist to help that we don't spread the virus to our Zimbabwean counterparts.
Final one, MEC, you met with the South African Council of Churches on Sunday. There's now an outcome. I'm sure you've seen some of the statements that have been released from the Z2, both of the ZCC churches, suspending services for the Easter weekend. Is this a relief for you?
It's like I was saying after the meetings that we have with the South African Council of Churches and both our churches, the St. Agnes and the ZCC, to say the meetings were very progressive. We have been having a good relationship as government with those churches, and I've given example, even the campaigns of NICD, HIV/AIDS, we've been doing with them. So even when we went to make the presentation, we didn't impose ourselves. We went and present facts. The first meeting was led by the minister. The second meeting was led by the premier. The other one, I was with my officials of SABC. So we were able to outline and explain to them the danger, what the risk, what it means, why we're saying you can't have more than 100 people. Actually would appreciate if people could be 10 and they could understand. That's why you see this particular outcome. It just shows you that how if we're working together and no one, you don't find somebody imposing themselves on the others, but you persuade each other, you show each other. And I think the collaboration and the relationship that government has been having with churches, it's being reflected today when we're having these particular changes. And you would have seen also all political parties are coming together on this, even at a provincial level, to say this is not about which political party you belong to. It's about the people of South Africa that we need to protect their lives and work together to make sure they don't get this virus.
MEC, thank you so much for your time. That is the MEC for Health, Dr. Popi Ramathuba, speaking to us about the measures that have been put in place in the province and a sense of relief as well around the negative test outcomes that came from the Wuhan students who are in the province and being quarantined. But let's move over to this particular story. The economic hub of Africa, Gauteng, has the highest number of COVID-19 cases at 62 in South Africa. These also include local transmissions. It comes amid fears that government could struggle to contain the spread of the deadly virus. Gauteng Health MEC, Mr. Dr. Bandile Masuku, actually joins us now on the line. Good evening, MEC, and welcome to African Perspective. I've just spoken now to the MEC of Health in Limpopo, and she says that one of her biggest concerns is the Easter weekend, and considering that in Gauteng, for instance, you have the highest numbers, and a fear that this virus could spread into Limpopo, the Limpopo province, and probably even beyond the border of the Bay Bridge.
Yes, I think it's one of the concerns that we have to deal with as we are approaching the Easters, particularly for people that will be traveling to other parts of the country, not only Limpopo or Zimbabwe. I think even other parts of the country, we are going to have the same problem. So we need to develop and make sure that we have a plan which will be able to screen all the patients or all the people that will be living in Gauteng. But it is a matter of concern that we need to respond to.
What would be the low-hanging fruit in terms of that plan that the Gauteng government can institute, or even the two governments themselves can institute to ensure there's a containment of the virus?
I think, the word using that we need to contain, it means that we need to minimize what we said the president termed non-essential traveling. So I think that's one of the things that we need to apply and we need to enforce so that we don't have a lot of people leaving the province going to other parts of the country. So we need to be able to enforce that type of the regulation in terms of enforcement. And I think in terms of the gazette that has been passed through today, there are things that we also, by law, we need to enforce.
Okay. And speaking about the local transmissions, is this a concern for you at all? And do you think that the local transmissions on their own could also see a rise?
Yeah, they're an important marker of the control of the disease process. That's why we need to improve on our contact tracing in making sure that we are also rapidly able to identify the contacts. Because when you look at the curve of infections in terms of the peak, usually the contact tracing or the community-acquired infections are the one that takes longer for them to plateau and even have a decreasing pattern.
And MEC, let's just quickly touch on foreign nationals. Of course, Gauteng itself being the most populous province in the country. Are there measures that are being put in place to ensure that even foreign nationals who may be undocumented get the necessary help they may seek?
I think we've been, taking care of, foreign nationals. But what we have actually said as Gauteng government is that this outbreak gives us an opportunity to enforce and even bring back, the authority of government and also bringing order. So one of the things that we are going to do with Home Affairs in Gauteng is just to try and get people who come through our facilities who are foreign nationals to be documented so that we start the process of documenting foreign nationals into the country.
Don't you think that sort of approach may just push them away and they'd fear to come forward, as we've seen, for instance, when it comes to census, when census is being conducted and census doesn't actually need people to have local documents or be documented. The concern that Stats SA has raised before is that you still find undocumented foreign nationals refusing to come forward because they fear the law.
Yeah, I think it's one thing that we would have to deal with as it comes. But I think people who are seeking help, they would always normally come to hospitals and our facilities. And this is a project that we started even before, the actual outbreak became a pandemic. When we looked at the mothers that visit our clinics, antenatal clinics, that we thought we'd start the process just to formalize and make sure that we document them, not to refuse them treatment.
Okay, Dr. Bandile Masuku, thank you so much for your time. That's Dr. Bandile Masuku, the MEC for Health. Now let's move over to Europe. Italy has again recorded the highest single-day coronavirus deaths at 475 as the death toll in that country reaches 4,000. Portugal has declared a state of emergency while the UK has suspended schooling from Friday. England is one of the countries on South Africa's travel restriction list. Now let's go to London now, where Stuart Smith is joining us from update around what's happening in London. Stuart, a press briefing earlier on from Boris Johnson. How has this been received? Hi, Stuart, can you hear me? Okay, we're going to try and re-establish that line with Stuart. In the meantime, let's move over to this story. The World Health Organization says its advice for Africa is that the mass gatherings should be avoided. The WHO Director General, Tedros, briefed the media earlier on.
Countries must isolate, test, treat, and trace. If they don't, transmission chains can continue at a low level, then resurge once physical distancing measures are lifted. WHO continues to call on all countries to implement a comprehensive approach with the aim of slowing down transmission and flattening the curve. This approach is saving lives and buying time for the development of vaccines and treatments. As you know, the first vaccine trial has begun just 60 days after the genetic sequence of the virus was shared by China. This is an incredible achievement. We know that many countries now face escalating epidemics and are feeling overwhelmed. We hear you. We know the tremendous difficulties you face and the enormous burden you're under. We understand the heart-wrenching choices you're having to make.
Well, let's go back to SABC reporter Stuart Smith, who is joining us from London. Stuart was saying earlier on that Prime Minister Boris Johnson had a briefing earlier on, and he has come under a lot of flack previously for failing to implement measures to try and contain the coronavirus. What's the reaction been from this particular press briefing?
Well, that's it. Especially teachers, head teachers and many members of the public with children of their own in schools had wanted the Prime Minister to take this measure much earlier than he has. He has now done it. And he emphasised he's done that not because there's a risk to school children, particularly from the virus, but because schools are already struggling to provide enough teachers to look after the number of children, and also as an extra way to reduce the burden on public services. The Chief Scientific Officer saying that some children will remain. The children who have parents who are either working in the National Health Service or who have parents who are delivery drivers, these people are essential to keep the economy moving. So those children will stay in school, but for everyone else, school's out.
Okay. And then when it comes to the number of deaths at the moment, and I think the number stands at 104, 32 that were confirmed over the past 24 hours or so. Does he take responsibility that at the moment England is being flagged as one of the countries with the highest number of infections and also restrictions by various other countries that have said that they are imposing travel bans on people travelling from England?
Yes, so the UK is both further behind in the virus pandemic by about 3 weeks, our chief medical officer is suggesting. So it's not as advanced in the stage as, say, Italy or Spain. And indeed, the social restrictions are not as advanced either. Everything at the moment is voluntary in the UK. We're not seeing lockdowns yet, as in other countries like Spain, France and Italy. And people are still free to move around if they believe that their travel is essential. But indeed, 30 deaths just in one day, a huge number, unprecedented so far in the pandemic so far in the UK.
What are the lawmakers saying about this, and also the failure, at least, from the Prime Minister to try and implement these measures to try and contain the spread of the virus? Is there sense at all that there was much focus on Brexit as there should have been focus on this immediate emergency?
Well, the UK's Labour Party, the official opposition party, does have some things to say to the government about its handling so far, mostly focusing on the lack of measures announced for renters. There was a huge £330 billion package released on Tuesday to try and help people make it through the economic side of things, but nothing for renters. That's one thing Jeremy Corbyn, the leader of the Labour Party, picked up on. Boris Johnson's also been criticised for the lack of resources within the healthcare system to provide for face masks. Things as simple as that. Personal protective equipment is running low already within the National Health Service.
We're also seeing that there's a push, at least from some at least civil society, that are saying that private hospitals must make beds available.
Yes, and private hospitals are making beds available, but another point of contention, because private hospitals, some of them, are charging the NHS, the National Health Service, about £360, about $400 for those beds. So people are annoyed that it seems like the private health sector is capitalising on a crisis. But indeed, the National Health Service, the public health service, needs as many beds as it can get, and also ventilators, as well as all this other personal protective equipment for doctors and nurses.
Stuart Smith, thank you so much for your time. We've come to the end of tonight's show. Thank you so much for watching. Oh, before we... Okay. Producers are shouting, no, it's not the end of the show yet. Okay, so let's move over to this story. Okay, so we're looking to thrive, not to survive right now. That was a cautiously optimistic message from the managing partner of a small business in the United States. Factory PR is a communications company specializing in VIP and influencer relations and in tech, fashion and consumer goods sectors. And due to the impacts of the coronavirus outbreak in the country. They, like many businesses around the world, small and large, have had vastly to shift how the company and staff operate while navigating impacts of the virus and various restrictions put in place, not just for their own company, but their clients as well.
We're being affected in so many ways. I mean, every single one of our clients, and there are 30 plus of them, are being affected in their own way, whether it was supply chain when this first hit China, luxury goods that are manufactured or designed in Italy, or companies in Silicon Valley where, you know, it's currently on shutdown. So everybody's experiencing it differently, and we're having to be really agile and nimble to adapt to that.
That's a message not unfamiliar to those running businesses across the planet, as companies walk a fine line between respecting a public health emergency and trying to stay afloat.
Factory PR is essentially a small business in the United States, employing around 40 people at their 3 locations around the country. Here at their Manhattan, New York office, usually a buzz of activity during the middle of the week. People sitting at their desks, working the phones, working their computers, an adjacent showroom showcasing client products from fashion to innovation. But as you can see behind me, everyone has been ordered to work from home as businesses now embrace a new paradigm shift in the face of the coronavirus.
Swarbrick says it's an interesting balance and that they're walking a fine line.
It really hit home for many of our clients a couple of weeks ago when South by Southwest was cancelled. We had many keynote speakers booked to speak there. Coachella, the big music festival in California, we had a lot of influencers booked to go and activate with various brands. So this really sort of started this snowball effect. And right now everybody's just rethinking strategies. We've thrown strategies out the window that we've developed for 2020 and are now looking forward at how we'll communicate and how brands will engage with their communities in this new world order.
Their clients include ASOS, Hyundai, Marriott International, Happy Socks and Tinder, to mention a few.
So being a small business in the United States, you would have learned a few lessons having dealt with this crisis now for a number of weeks. What advice would you give small businesses in a location like South Africa that is now just beginning to come to terms with some of the mitigation required in dealing with this virus?
As a small business, I would say conserve cash. We're looking at a kind of a 90-day window that we need to persevere through. We don't know what's going to happen, so you need to shore up your business, protect your people, sort of take advanced measures to make sure that you're able to work remote, test your conferencing capabilities, make sure that you're able to operate remotely. For us, that meant that as much as we need to be working apart, we need to come together as a team. Hi, how are you doing?
I'm doing good, how are you?
With staff locations across the country in Los Angeles and San Francisco, embracing technology has been key.
We had our first all-hands meeting this morning via video chat, something that we've never done before in our 18-year history. And it was a wonderful moment because people really wanted to come together and share. We made sure that everybody had their moment on camera to speak to the company, and just to see each other's faces was so nice. So we're adapting in those kinds of ways. We're trying to over-communicate, asking each other how we are and how we feel. How are our families affected? Are you feeling well? Are you nervous? People, need to feel cared for. And as a small business, we are a lot like a family. So that's really important to me. It's our culture that is kind of front and center for me right now.
As circumstances evolve, particularly how human interaction happens, with restrictions on movement becoming more commonplace, COVID-19 has become a moving target for everyone.
I'm nervous. We're all nervous. There is no certainty in this time. We don't know how long this will carry on. We can make provisions for our 90-day period, but all you can do is trust that you're making the right decisions for you, for your company, for your family, and constantly be thinking ahead.
As the long-term strategy becomes not just keeping everyone healthy, but ensuring, despite the unexpected headwinds, that businesses like Factory PR are able to keep the lights on.
Well, one thing we can say is that the coronavirus is forcing us to reimagine life and reimagine the workspace and also how we go about doing our business. And no doubt at all that you too might just be affected. This is how we come to the end of this evening's show. Thank you so much for joining us. We're back again next week, same time, same place. Who knows, I might be coming live from my bedroom because of the coronavirus. Bye-bye.
This week alone.